So I just want to be focusing on the Imunoglukan, which is one of the representative from the beta-glucans, and it's quite unique, especially respecting the position in the prevention of respiratory tract infections among all the other products from this group. It's because we have quite nice number of the studies, in vitro, laboratory, animal experiments, the studies with healthy volunteers like the elite athletes or runners. We have some open label studies. I will show you the international evaluation of the efficacy of this product across Europe in different countries. And of course, we have also placebo control studies, which are important in doing the systematic reviews. Across all the studies, and I will show you the number of the patients and children which were involved in this study, we know that it has very good, excellent safety profile with very good tolerability. I will also show you later on. This was the study when we analyzed the first experiences with Imunoglukan in the daily practice. And what was very important is that comparing two seasons, one before, one after each other, there were in more than 71% of the children, so more than 2/3 of the children, we observed a more than 50% of reduction of respiratory morbidity. In general, there was 60% decrease of the number of respiratory tract infections. The majority of the children were under the age of 4 or 5 years, respecting the diagnosis of recurrent respiratory tract infections, which was important inclusion criteria. And usually the schedule was very similar. There were 3 months of application of Imunoglukan at the beginning of the season, so in the early autumn, and then 3 months of follow-up. And each time we compared the same period with the previous age. What was another important thing? The results were comparable, analyzing the children younger than 4 years and analyzing the children older than 4 years. What about the duration? As you see, there is quite comparable decrease also of the duration of the respiratory infections. From 40 days in the previous season, we are dropping down to 20. These are only the graphs of the numbers of the patients which were involved in the particular countries. So altogether, the studies were finished by total number of 1,209 children, which fully completed and followed the protocol of the clinical trials. So the first important result was the analysis of the drop down of the respiratory tract infections, and you see there was more than 45% decrease of the number during the study period comparing with the previous year. So from 7 to 3.8. Taking into account different forms of respiratory tract infections from upper respiratory tract like otitis media, common cold, tonsilopharyngitis, going to the lower respiratory tract like bronchitis and pneumonias. As you see, there was strong, significant decrease of very important number of the respiratory infections in whatever type of these diseases. So the summary of these open label studies: decrease of number of respiratory tract infections, without any severe side effects, with excellent tolerability, with very good reported efficacy. And what is interesting, we showed consistent results across different genetic background, across different countries, across different geographical settings in Europe. The summary of the immune results with Imunoglukan from our published data: Imunoglukan can support the increase of immunoglobulin production, natural killer cells function and counts. It can improve post-vaccination response. We have some animal data, but also some preliminary data from clinical settings. It can modulate specific cellular immunity and has also some very interesting anti-allergic effects. Just one slide with our double-blind placebo-controlled study, which was published in International Immunopharmacology. These were 247 children with Czech and Slovak Republic. And the most important result was also confirming in this double-blind placebo manner decrease of respiratory tract infections, flu and flu-like diseases, decrease of lower airway infections with very good tolerability. So just to summarize, we know that immunomodulation is important part of prevention and treatment of respiratory tract infections. And in the first line, we should use especially natural immunomodulators. We can sometimes use also the combination of different products just to support the mechanisms of action of each other. And what is important, we should have very high purity and concentration of active substances, and we should clearly know how the particular immunomodulator is working in our immune system. And we should say for the Imunoglukan, we have the confirmation and the data and evidences on all of these steps regarding the use of immunomodulation in recurrent respiratory tract infections. And just to summarize, we do not need to stop this treatment if there is a case of acute infections, even we are trying to increase the dose to support immune functions. There is no need to stop this product during the antibiotic course. There are no interesting and important interaction with some other treatment and symptomatic treatment for infections. And once acute symptoms improve, then just continue at the standard dose. So during the acute infections, we are just increasing the dose to the double or triple dosing.